Yeah.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. Welcome everyone to another session of VOTP. Just a brief introduction of VOTP. VOTP stands for Voice of the People, and VOTP was initiated after October the 7th. The whole purpose of VOTP was to and make each and every one of us understand the value and the power in one's voice. At VOTP, we want each and every one of us to take accountability first and for ourselves with respect to Allah's commandments. And secondly, we want to empower each and every one of us to be able to demand accountability from the rest of the community, especially the leaders. And to be able to do this, we realized that we have a lot of gaps which we have to fill within ourselves, and hence started the sister project, Find Your Truth. Today, we have a very, very important gap which we need to fill. And this gap is developing a healthy relationship between a husband and a wife. This area has been subject to a lot of misinformation, a lot of myths. People, get bits and pieces of information, from wherever and everywhere. And based on those myths and misinformation, they lead their entire life. And unfortunately, this really does not fulfill the the main benefit of this beautiful relationship which Allah subhanahu wa ta'ala has made. So today, to clarify all the misinformation, to get rid of all the myths, and to take this relationship to a higher level of mutual respect and spiritual upliftment, we have with us Dr. Raheel Sikandar. Dr. Raheel Sikandar is an obstetrician and gynecologist by profession. She specializes in maternal care and in relationships. And inshallah, we will go ahead and get started with a very, very valuable information on this topic. And at the end, we will have a question and answer session as well. So let me go ahead and welcome Dr. Raheel Sikandar. Welcome to the platform of VOTP, and we are all ears to learn from your wisdom and practical experiences.
Okay, Jazakallah, Sister Farhana. So today we are going to, it's kind of a journey to explore ourselves, right? Know ourselves, how Allah Ta'ala has made us. And from my side, I'm going to talk about first about how our body has been made to fulfill this special relationship between husband and wife. So to start with, we'll be with the name of Allah. We will start with the anatomy of the human body. But before starting, I would like to emphasize that it is such an important thing that the sexual health has been given a priority in the global public health by the WHO also. And the goal behind is again overall well-being and to know yourself and to get to know your partner as well. So, sexual health is actually a fundamental human right, essential for the development and dignity. And access to the accurate, respectful health information is not just an educational activity, but it strengthens the marital intimacy and overall well-being. So, with this importance of this subject, we begin with the anatomy of the female sexual organs, and it can be divided into internal and the external genital organs. This is in both the partners. A female body also has an internal organs, which are tubes, ovaries, uterus, and the male also has got internal organs, which are the prostate, seminal vesicle, and these testicles. Although the testicles are lying outside, but they are actually considered as the internal male genital organs. The How can I remove this strip of our pictures? Can you help me, Faida?
What do you mean?
These you, me, and our pictures are coming here, blocking my PPT.
Oh,
Can I
turn
do
off the
that?
participant. You're saying your pictures are coming. Is it participants you can see?
Yeah, yeah, yeah. We
Just
all.
turn it off. Go on participants and click at the bottom.
No, I don't know how to.
On the
Okay.
Zoom thing at the bottom where you have chat, participants,
Yeah, there are participants,
click
and
on that. There's an arrow. Click on it.
yep, I clicked that.
Does it disappear?
Nope. No, it does not disappear. Okay. It's
Mm.
okay. I'll try. So the internal organs, as I have said, in the female are the uterus tubes and the ovaries. Ovaries are the one which store the eggs, and eggs to a woman are given at birth, right? We cannot make new eggs. But if we look into the male internal organs, testicles can keep on producing new sperms, and they are always there. So that's why the age of the lady is important when we are talking about the childbirth or the infertility treatments. External genitalia is the area under leg or the bikini area, and it includes the reproductive system as well as the urinary system in that portion. And the reason is that it is actually for protection of the internal organs, and it facilitates the sexual intercourse as well as the sexual pleasure, thereby enhancing the intimacy, physical intimacy. So the first part of the external genitalia, medically we call this whole area between the legs as the vulva. And it has this area has got the structures for reproductive system, that is producing babies, having sex, as well as the urinary system when one wants to pee. This is a fatty cushion over the pubic bone, and this mound of fatty tissue covered by the pubic hair as well. The main job is protection, as well as it is used as a cushion for the sexual activity. Presence of the hairy skin over there is to produce chemical signals, and that can play a role in the sexual attraction. Why I've chosen this picture is that even this portion of the body, which can change because of the childbirth or obesity, this can be improved by the surgery. You see, there is a fat deposition here, and this somebody wants to get skinny. So all these are amenable to the surgeries and can be done according to one's aesthetics. The vulva or the external genitalia has got two sets of protective folds. These are called the lips in the journal language. Medically, we call it labia majora and labia minora. The two bigger folds. Now, see this, I can't put my cursor on it because our pictures are covering it.
Yeah, the majora. I've got my cursor on it. Does it show? Yeah, just a bit
Oh,
down, just a bit down, maybe. Yeah, that's
yeah,
majora, and this one's
yeah,
minora.
yeah. these are skin folds which protect the internal organs, and they have a rich blood supply, get engorged during the sexual activity, and inside this, exactly inside the labia majora's fold, there is a labia minora, right? These are the inner folds. Again, they join above to make hood over the clitoris, and they are also richly supplied by the blood, so that when a woman is sexually aroused, they gets filled up with the blood and get swollen and add to the sexual pleasure. The clitoris is the female organ which is responsible primarily for the sexual pleasure and sensation. It is highly sensitive tissue with erectile tissue in it, similar to the penis, and its visible tip is called the glans clitoris, which is again very, very highly sensitive. This is also supplied a lot with the blood, and so it gets swollen and got erect when lady is sexually aroused, and increase in the size. There are certain glands provided by the natural anatomy, and the reason for presence of these glands is to keep the area moist and keep the sexual act smooth. So the vestibular bulbs, they just start from underneath the clitoris, and they move along whole length, covering the vestibule of the vagina, right? The pink area inside that starts from the under the clitoris, and then it goes down deep, surrounding the vaginal openings. So when there is a sexual activity going on, they get filled up with the blood, and then put a pressure over the clitoris and in this vaginal opening. So this also add to the pleasure during the activity. Bartholin glands are the glands situated at the this lower side of the labia majora, but they opens into the vaginal, near the vaginal opening. There is an opening for them, and that keeps the vulva or the external genitalia moist most of the time, and especially during the sexual intercourse. Keeping moist is important to reduce the friction, otherwise, it can cause the damage and will lead to the infection and a painful intercourse. Now, vagina, it is actually elastic and muscular tube which serve as a connection between the. You put your cursor on the picture because mine is on our faces. Is it okay, Faidawari?
Yeah, can you see my cursor or not?
Yeah.
I
Oh, okay.
can't see, but the others will be able to see.
Yeah.
Okay.
We can
Okay?
see.
Okay, okay. So the vagina is an elastic muscular tube, and that serve as a connection between the inside and outside of the body. It connects cervix, that is actually the outer opening of the uterus, and to the vulva or the external parts. The external opening is sometimes, most of the times, is covered by a thin elastic membrane that is called hymen. This membrane is very thin and always have openings into it. And that is why when a baby is born, a baby girl is born, sometimes people might have noticed the blood coming out from there, and mothers get worried about it. It is because the maternal hormones were acting on the baby's uterus, and that produced the menses. So these menses, they escape through this hymen, And this we usually explain to the mothers of the female child that they need not to worry and need not to do anything when the effect of the maternal hormones will be gone, then this will dried up. The main function of the vagina actually are this canal is for the penetration that occurs when and the semen is received into it, right? That semen doesn't go up, but it stays within the vagina and provide a medium for the men's sperms to swim up and go into the cervix. Semen does not travel into the uterus because it is acidic and it is harmful if it reaches the uterus. Other function of vagina is that it is a birth canal, and from here the baby comes out, and it is its elastic nature that allow the whole baby and its body to exit from there. It also acts as an outflow tract for the menstrual blood, and and that is all about the anatomy of the internal and external sexual organs. Now we talk a little bit about the physiology of the sexual response or the sexual cycle. In both men and women, it has got 4 phases. And the first phase is called the phase of excitement or the startup. And here it is triggered by either mental stimulation or by the physical stimulation, and the body starts to warm up and in the form of increased heart rate and blood pressure, and the muscles begins to get tense. The breasts get engorged and the nipples harden and the skin may develop flush. After the startup, there is a building up. The body reaches its highest level of arousal before the orgasm. Muscle tension becomes more intense across the whole body, including the face and hands and feet. Female vagina will expand and gets lubricated. In case of male, the penis remain fully erect and may release pre-ejaculate fluid. The climax is orgasm, a brief moment of peak pleasure. Involuntary rhythmic muscle contractions happen throughout the body, and it results in a powerful, sudden release of sexual tension and intense feeling of pleasure. After this, there is a period of resolution when body returns back to its unaroused state. The muscles relax completely, blood pressure and breathing pattern drops back down to the normal, and there is a feeling of satisfaction. This relationship is not linear. It's in the form of a circle that the sexual arousal is could be as a spontaneous sexual drive when someone wants it, or it could be a response sexual arousal, a response to sexual stimuli, some which could be biological, that is touching, and the psychological, speaking romantic sentences. So all these are the stimuli that arouse the female. And after this arousal, the desire also sweeps in, and there is an emotional and physical satisfaction once the orgasm is reached. And with this physical satisfaction and emotional satisfaction, emotional intimacy also begins. When there is an emotional intimacy, one seeks out and one is receptive for on these stimuli. This is another graphical form of showing that there are these stages, the excitement, plateau, and orgasm, and then there is a resolution phase. The difference between male and a female is that a female can have different periods of different stages, right? Males usually have a same kind of a period, and then there is an orgasm, and then there is a resolution phase, after which he becomes refractory. Usually it takes around 15 minutes or more. But the stages, they overlap in a female, and she can have multiple orgasm in the same period of time, and then she gets into the resolution, and her refractory periods are also different. They are not same all the time. Um, if we now see the anatomy as well as the physiology, this is all designed to facilitate the penile vaginal intercourse. There are other pleasure zones, anus, mouth, breast, and the other body areas, but they are for the pleasure and excitement, and they are not designed for the intercourse because the body lacks natural and physical or even physiological capacity to have intercourse any other place other than the vagina. The physical benefits of the healthy sexual activity are that it improves the fitness and the cardiovascular health, it boosts the immune system, fertility, and sexual function, and it also has got a very good effect on the skin and the hair health just by increasing the blood circulation in these organs. It reduces the risk of high blood pressure, pain, and overall illnesses. And it also reduces the risk of certain cancers like prostatic cancer and the mortality. If we talk about what should be the optimal frequency, one cannot force someone to have it, but when we look into the mental health, then at least 1 to 2 times per week shows the greatest protective health, protective effect on the mental health and psychological well-being, and this can serve as a reference standard for emotional health. Sexual satisfaction is strongly associated with the positive and successful mindset, and this satisfaction lead to significant factor affecting their marriage and the divorce rate. A healthy sexual relationship provides a context of peace and psychological security, and it fosters a sense of personal security, which translate into having a purpose towards life and a very clear purpose by both the spouses. Improving an individual's sexual self concept can significantly boost their well-being and confidence in achieving both mutual and the personal goals. So, when somebody is having a satisfying relationship, this also improves the communication, and this relation then the communication by is improved when this relation is established, then there is a emotional and mental language developed between these spouses, and that helps them for overlooking their personal differences while maintaining the mutual feeling and understandings. So let's move towards what are the myths around about this. So myth number one, a very common in our society, is that the hymen is a proof of virginity, and always breaks and bleeds with the first intercourse. As we have discussed, that it's a flexible, thin tissue that varies in size, and it can be stretched or altered by everyday activities such as sports, tampons, and the exercise. Vaginal douching is healthy and scented products are necessary and the pubic hair are unclean. This is second myth. In reality, vagina has a self-cleaning mechanism. You need not to overwash it because it is going to disrupt the natural pH balance and can lead to the infections. If a couple loves each other deeply, then sex will be natural and perfect for them. Reality is that even loving couples often struggle at first with shyness, pain, and difficulty or misunderstanding needs. Love does not automatically grant a sexual knowledge. So one has to realize that. Sexual intimacy is a learned skill in a marriage. People are not automatically learned in physical intimacy, and they need time, open communication, and patience to feel comfort and get fulfilled. It is normal for both the partners to adjust expectation and learn what feels good and what does not. A healthy marriage is not one that is perfect from the day one, but the one in which both the partners are willing to learn, talk, and grow together without shame. There is a myth that a good wife or husband should always be ready for sex. This myth actually ignores normal physical, hormonal, and emotional changes that takes place. In case of women, the pregnancy, childbirth, breastfeeding, menstrual cycle, or stress, general health problem, or tiredness. Then there could be tiredness and mental load, relationship stresses. There could be medical issues. So all these things, they naturally affect the sexual desire that fluctuates having these. So there should be consent, comfort, and mutual willingness are always essential for healthy intimacy. A loving spouse does not demand sex. They notice their partner's state, listen to their needs and their readiness, and care for their enjoyment too. The myth is that if intercourse is painful, it is natural, and the women just need to relax and try harder. Painful intercourse, medically we call it dyspareunia, is never a sign of weakness or I don't know what is it, or it's natural. It is often a sign of medical and psychological issue that deserves the care. Many women, they do come to us with this complaint, and I don't know after how many years of suffering they can spell it out. Pain is not in the head actually. It may be due to specific factors, which could be infections, dryness, hormonal changes, physical factors like pelvic floor muscle tension in the form of vaginismus, which is a sudden spasm of the vaginal muscle and the legs, which do not allow the intercourse. Or inadequate arousal or rushing through the activity. Previous trauma and anxiety also has a role on it, and there might be the problems or causing pain at the beginning of the activity. So it has to be undertaken that pain is a medical symptom. It's not a moral failure. It should be discussed openly and assessed professionally. A caring partner is patient and supportive. and he's never demanding. He or she, both, never demanding. Men always have a higher sex drive and should always initiate. Well, this is a myth again, because the stereotype pressures men to act constantly interested in these desires. But this is unfair to both the partner. When one partner stays silent, that is, lady stays silent and men always have to initiate. Actually, the desire level varies widely, and it is normal for some women to have it more than even their husbands. And the factors that affect it could be illness, stresses, medications, emotional factors. They can affect the desire and reduce it at times. When only one partner is allowed to initiate, the other may feel rejected and ashamed. So both the partners can initiate, and both are allowed to feel the desire or to be tried sometimes. Honest and kind communication about these needs build trust and not the shame. It should not be felt like that it's shameful to talk about it, but actually it is your trust in your partner that you can communicate on these topics as well. Then there is a myth that talking about sex is shameful, and good couple just know what to do. They should not talk about it. But we all know that silence leads to misunderstandings, resentment, and persistently the couples will suffer unnecessarily because they are too embarrassed to talk about their needs. Healthy sexual relationships are built on respectful communication, and it is appropriate for spouses to discuss comfort, discomfort, timing, frequency, and in a modest and respectful way. Not talking often leads to avoidable pain, frustration, and emotional distance. So the message should be that discussing intimacy privately and respectfully within the marriage is not vulgar, it is respectful. Clear communication strengthens both emotional and physical closeness. Another myth is that after childbirth, a woman's body is ruined and sex is never same. The reason for this myth is that while pregnancy and childbirth causes changes, it does not lead to permanent damage or end of the satisfying intimacy. Many postpartum issues such as pain, dryness, fear, fatigue, low desire are treatable. With proper healing time and support, couples can regain and often improve their sexual relationships through they can use the lubrication and gentle reintroduction of intimacy, pelvic floor exercises, and medical support when it is needed. Emotional support from the partner during this period is really critical. Postpartum period is a phase of adjustment and not a permanent loss. Patience, kindness, and medical care can restore the comfort and closeness. Another myth is using lubrication or seeking medical help for sexual problems is a shame. This belief prevents many couples from accessing the healthcare help or solution for their common difficulties. Issues like dryness, pain, erectile difficulties, or low desire are common, and medical and psychological explanations are there. The support options are legitimate, and defined forms of care are the lubricants or pelvic floor therapy, counseling, or appropriate medication. Seeking help is a sign of responsibility towards marriage, and it should not be taken as a weakness. Just as couples seek help for other health issues like blood pressure, diabetes, they can also seek help for the sexual issues. Preserving mutual comfort and respect in intimacy is a part of caring for marriage. This means they do care that their marriage relation should stay happy and healthy. So, Jazakallah khair. This is all from my side. And I just want to share this picture of this book, which in the last session somebody wanted to know if we can refer guidelines for intimacy in Islam. So this is a very good book that I would recommend. If our sisters go through it, they will have many of their queries solved. So Jazakallah khair again. I'm here for your questions.
Jazakallah khairan, Dr. Raheel Sikandar. I think for a very, very important talk, and subhanallah, you busted a lot of myths in this, talk. Alhamdulillah, I think our audience will have definitely questions to go more deep into those. Please go ahead and you can type in your question in the chat, and I can ask them on your behalf, or you can also raise your hand and unmute yourself as well. So please go ahead and ask questions. Yeah, so in the meantime, when our audience is thinking of questions, let me ask Dr. Raheel Sikandar. So what is the most commonest problem that you see in your clinics, in women with respect to sexual intimacy? What have you found?
Yeah, pain is very common thing, and mm, this we find many causes for those. Infection is very common here, and one of the reason for infection again is their general health, because they are anemic. They get other body infection as well, but this is the most vulnerable area where they get these infections. So their journal health need to be corrected first, and then we give them the treatment for this particular pain, and they do get well, alhamdulillah, with a very simple treatments. The Yeah, this is the commonest problem that we are seeing in our clinics.
Okay. So pain is a very common, subhanallah. I think we have one of our sisters, in the chat as well. Like she had surgery, normal delivery, and she had a lot of stitches, as a part of that procedure, and she still has pain. And any advice for her? Or
How long she has had this delivery?
6 years now. It's been 6 years.
6 years. 6 years.
Subhanallah.
Yeah, it's too long. Usually the pain because of these stitches, the longest period we see is 1 year. And if it is more than that, then it has to be something she need to be treated for. She should seek some pain help.
Yeah.
There are pain clinics, and they do give her some kind of therapy. It's not
Okay.
a simple pain. Yeah.
So please go ahead and seek out medical attention. So that's so it can
Yes.
be treated with various
Mm.
modalities. Okay, already. Any other questions? You can please go ahead and type in your chat as well as ask. Yeah.
Dr. Rahi, you had that, you had that graph. It had three colors on it with the women and the men showing. What's the three colors for? If you can go back on the
Yeah.
please. I couldn't quite get why. Oh, what happened?
Sorry, it's gone. Yeah.
Can you go back? Here, yeah, here.
And
Keep going back.
The sexual
yeah,
arousal. Yeah. Yeah.
you see,
What is the
men
red for and what's the blue for?
these are the graphs showing that a lady can have multiple, all these three stages can overlap multiple times in a lady. She can have this quick going up, coming down, right?
Oh.
At the same time, another one is beginning with small multiple orgasmic contractions, right? And so is the third one also. So
Okay.
this is the difference between men and women.
Mm. Okay, that's good. I got it now. Yeah.
So in the so Dr. Here in the red graph, the women actually it does not have any, does not reach the orgasm, right, on the red
He
one.
reached multiple, but the small one, the
Wait, wait,
strong
wait.
was there.
Does not reach a
These,
strong one. Mm.
yeah, yeah,
More in the plateau phase, yeah. More in the plateau
yeah.
phase. Yeah, already. Yeah.
So some more questions, Sister Farah.
Mm-hmm. Yeah, we do have a question in the chat. What precautions must be taken, for, when the girls go for, after marriage, have the first physical intercourse? Any precautions they should have in their mind?
Medically, we don't advise them to. They should know, number one, they should know their anatomy,
Mm-hmm.
and they should know the intimacy, sexual response, what it is.
Mm-hmm.
And once they know it, then and they have a very good partner, then there are nothing special that they need to take care
Yeah.
of. Yeah.
Okay. Yeah. So it's most important. Knowledge is the most important one. Yeah.
Very important. Very,
Yeah.
very important. Yeah. Yeah.
Exactly. Alhamdulillah.
Hmm.
All right. Any other questions? Please go ahead and Dr. Haley, if you could just explain about how much time does it take for women for to get sexually aroused, in the sense to increase the blood flow in the genital organs versus a man. Is there any time difference? How long should the foreplay be? Any advice on this regard?
Yeah. You see this picture, this arousal is affected by many factors, right?
Mm-hmm.
Could be spontaneous when there is a hunger for it, right? It will be spontaneous when you want it actually yourself. But otherwise, there could be some factors, biological and psychological, which can even reduce this response or make you receptive for it. As I have mentioned, the childhood trauma, some kind of a bad experience in the past, so they fear the in case, especially in case of the first intercourse, there is a lot of fear, and that won't let you just flow of the secretions are stopped, so they are dry. And then if somebody rushes, then it causes injury and it causes pain and all these things. So this sexual arousal, it is different for every person, and but if there is a good happy relationship and somebody is doing the physical and verbal foreplay, then it hardly takes about 15 minutes to get a lady going, 15 to 30 minutes to get a lady start arousing and developing all the blood flows towards it. It may not be the orgasm that they reach within this 15-minute, but yes, the body starts to respond to the foreplay once it is being either touched or psychologically stimulated.
Okay. Jazakallah khairan.
So I have a question.
Yeah, go ahead.
It might sound stupid, but I feel like most women don't have the concept of orgasm because religiously it's been taught that it's a woman's duty to pleasure the men. How to introduce that concept of orgasm to the women who've been married 10, 20 plus years?
How to introduce this?
Yeah, how do I explain to her, like, is it okay to ask them to explore themselves,
Yeah.
personally and see what feels right, and then maybe go out and talk to the spouse?
See, in a private conversation, when women come to us and they say, okay, they don't feel satisfied. So this is what we ask them: that do you achieve an orgasm? Sometimes they are knowing it, and sometimes they are not even knowing it. Some women would say, "We don't ejaculate the way the man is ejaculating." So
Oh
is it
no.
when I get orgasm, should I ejaculate like that? But these are the kind of questions. So then we need to explain all this, that that's how once you are being touched. Even sometimes we need to tell this to the men also. Okay, this is if you need to about the foreplay. We need to tell them, okay, they should let their wife to have this orgasm or the satisfying feeling. This will only happen when their muscles, they are tense and then they get relaxed. They may not have lot of fluid coming out, because this is what the most of the women ask. We don't have lot of fluid like it's men. How would we know that we are also released? So this is again, we need to tell them about this cycle and the muscle tension getting released after extremely tense stage. Then the contraction in the vagina also takes place. That also sometimes tell them that they have gone through an orgasm, that their vagina starts to contract, open and close, and this is a very sensitive feeling that if they have this. So that's how I tell them, okay, this is what is orgasm, and this is what is going to give you the maximum pleasure and the satisfaction of the activity from this activity.
Okay, so understood. Thank you. The next question is the UTI, the often UTI, and then women running away from intercourse because they think that intercourse is causing UTI. In your experience, we treat it with the physical health, like gut health and all that, or is there any other reason for it?
No, sexual intercourse does not cause UTI. The Until and unless somebody has had a urinary tract infection, uh, it could be the rushing over or without a foreplay that may lead to mild lacerations or irritation of this area. And if it is already inflamed as a result of fungus, is a very common infection that is actually normally present in our body. But once the lady's immune system is low, or she is consuming lot of sugars, or if she is using lot of douches and cleansing things in this area, then this fungal infection comes over there, and that makes the whole skin very, very thin. So whenever there is a sexual intimacy, this thin epithelium, this get lacerated. So this is what we do, that we check it if they have this kind of infection there. Another thing, urinary infection is, or UTI is has got some symptoms that there is a frequency or of the urine, but it always is confirmed by doing a test. If there are bacteria in your urine, then you are having UTI. Otherwise, it's not the UTI. It's only the external irritation of this area that could be because of thinning of this skin. And that thinning can occur because of excessive use of these cleansing things or the fungal infection.
Okay. Jazakallah khair.
Mm.
We do have a couple of questions in the chat, which I'm going to take. Unrealistic expectations that can stem from societal or even media portrayals, leading to pleasure, leading to pressure. So, for example, like one of them is the couples, they expect instant gratification, perfect compatibility, or constant passion, and how to manage these expectations. And I think you did mention that in one of your myths as well, that this kind of the pressure is there. So, how do you manage these expectations, Sister Dr. Raheel?
See, knowledge is the key for all these things. If we are expecting too much, if we are expecting wrong, then all we need to do is to straighten the actual knowledge or the reality to them. So if somebody is really interested, then they do, at least they resolve their problem. But the society nobody has a control on. So I think if we increase the knowledge among the populations, only then this is the way that they can avoid these unnecessary pressures over each other. And the book that I have shared is really a wonderful collection of Islamic evidence-based things. So there were references from Quran and Ahadith and telling us that what is right and what is wrong. That is a really beautiful collection. Yes, Saima.
Assalamu alaikum, Dr. Raheel. Thank you so much for such a nice presentation on a very important topic. सिर्फ मैं आपकी एक बात की तरफ तवज्जो कराना चाह रही थी जो इस प्रेजेंटेशन में नहीं है कि जो पेरीमेनोपॉजल टाइम है और पोस्ट मेनोपॉजल टाइम उसमें भी आपको पता है कि वी women have a lot of issues with intimacy because of the hormonal variations. तो अगर आप जो है later on किसी वक्त इस specific topic को cover कर लें तो that would be nice.
ओके हमने थोड़ा सा मेंशन तो इसको किया था इधर कि जो डिफरेंट पीरियड्स ऑफ लाइफ हैं वेमेन के फिजियोलॉजिकली जिसके अंदर प्रेगनेंसी भी आती है उसमें मीनोपॉज भी आ जाता है बोथ और थिंग्स और उसमें होते हैं ये इश्यूज यस श्योर पेरीमेनोपॉज ऑन इट्स ओन इज़ अ बिग टॉपिक तो इफ यू फील लाइक तो वी विल डू इट इंशाल्लाह बट ये जो
जी
सारी
बिल्कुल
चीजें ना
पेरीमेनोपॉजल चेंजेस जो हैं वो इतनी वेरिएबल हैं और उसमें आपको पता है कि हार्मोनल चेंजेस के साथ साथ मूड डिस्टरबेंसेस भी बहुत मूड वेरिएशंस कहना चाहिए
जी
डिस्टरबेंसेस
हाँ
तो नहीं
हम्म
क्योंकि उसमें खुद खवातीन को भी समझ नहीं आ रही होती और इट इज डिफिकल्ट फॉर द स्पाउसेस कि वो अंडरस्टैंड करें तो
बिल्कुल
आई
बिल्कुल
आई थिंक कि आपको इस चीज को जो है थोड़ा अगर आप एड्रेस कर
बिल्कुल
लें तो दैट वुड बी नाइस
बिल्कुल बिल्कुल इसको होना चाहिए पेरीमेनोपॉज की बात यह है कि वही फीमेल को पहले खुद अंडरस्टैंडिंग हो अगेन की टू एवरीथिंग इज नॉलेज द राइट नॉलेज so if they understand कि these are the changes taking place in their body और उसमें भी अगर वो हेल्प के लिए आ जाएं क्योंकि बहुत तो हेल्प के लिए ही नहीं आते ना तो इफ दे कम तो इसीलिए अब हम जो है मेनोपॉज से पहले ही HRT शुरू कर देते हैं व्हेन वी फील के देयर आर दीज मूड चेंजेस एंड प्रॉब्लम्स इन द रिलेशनशिप्स, सो वी डू स्टार्ट दैट। तो यस, यू आर राइट कि ये बहुत ही इम्पोर्टेंट टॉपिक है।
Inshallah. Maybe we'll plan for a
Thank
session on as well. Inshallah. We do have a couple of questions in the chat. Dr. Hill, at what age should a child, either a girl child or a boy child, be given information of the reproductive organs and all of that? Any recommendation? How early this information must be given to our kids?
देखिए, एनाटमी की नॉलेज तो नाउ दे आर गिविंग इट इन देयर इवन द स्कूल लेवल्स, दैट knowing their body. So this is, I think, a fear that they should know their body, what it is. And other thing is the functioning, right? That can be given once they are coming near the puberty and before they start to have the knowledge from the social media and their friends. I think this is the better time to tell them and tell them plainly what it is. This and I don't know if all the mothers are capable of telling this to their daughters, or the fathers are capable of telling this to their son. But this age before they go into the puberty and they actually feel the surge of these hormones where they don't understand what is happening to us, our body, they should be given some kind of a knowledge about it.
Okay. So maybe around puberty, they should actually have a
yeah, they must.
Yeah. And the anatomy must be very, very clear even before. Yeah. Okay. And I think one question: any particular ideal age for marriage? Is there anything which you?
I think in the last our discussions we discussed that, haven't we? So Allah subhanahu wa ta'ala says, whenever you are ready, and whenever you are ready, it means not only physically but spiritually and intellectually also. Whenever a person is intellectually mature enough to have a relationship, then there should be no hindrance to it. I think if we improve the halal marriages, if we make these easy, that is going to prevent the problems that we are facing nowadays.
Absolutely.
So we are feeding our children, we are making them bodily very healthy, but intellectually, whether they are healthy, they are good Muslims or not, this very few of us are able to rear such a children.
True. Inshallah. Yeah, I have a request for the audience. Please fill in the survey form. Please write in what you learned. What topics you would like us to bring in these VOTP sessions in the future. Please go ahead and do that. So that's very important for us. And yeah, please go ahead and ask any more questions we have. And as Dr. Raheel said, it's very important knowledge. It's very, very important. So please forward these recording when it's going to be available. Inshallah, it will be on the VOTP site, FIT site soon. So please forward this among your friends and family. They can, watch it. Even if they're shy, they can watch it in the comfort of their own rooms. So we need to spread this information as well. We do have another question. What are the things we need to know about our spouse before marriage? Any specific things we need to make sure we ask them? It's a very...
Is it a medical question?
I know it's very broad. I know there's so many. I was thinking it's a very broad category. Let me
It's
kind of try
very
to.
broad, and first thing is to know yourself. Okay, what
Yeah.
do you want to see in your spouse? And if your medical concern are that is not having any ca- infections or
Mhm,
diseases that he might transmit you.
mhm,
Uh, but how to know that is another question. So again, then there has to be somebody seeing the activities of the guy, and I don't know. In our families, we do things like that. That they search for the guy. How, what are his friends? What are his activities?
mhm,
So that give us some clue that he is a clean guy.
mhm,
So I think that's how you can just guess that he may be free of any kind of sexually transmitted
mhm.
diseases to be given to you. Yeah.
Yeah. Yeah. I mean, in our culture, it's not prevalent to ask for lab tests.
Yeah, we can't get it done. Yeah,
Yeah.
yeah.
Uh,
We can't even get the thalassemia screening done, you see.
mm, yeah.
So it's difficult. But
Yes. Yeah.
otherwise, in developed countries, even in Turkey, which is Islamic country,
Hmm.
they before getting marriage, they do get their some baseline tests done. But
Mm.
see, the decision of getting married has already been there. When you only go and officially want to register it, only then you will be asked to get certain tests done and all the medical history taken.
Right.
But the decision has already been made.
Yeah.
Mm.
Yeah. Yeah. Right. We have another comment. Learning about sex before marriage at young age is good, um, or before marriage is a good option. I guess the question is, should we learn it? Is it too early at a young age, or should we just wait just before getting marriage? Um,
Well, anatomy we should always know, right?
mm,
Right
yeah.
from the early childhood.
Right.
About the actual sexual act, it is fair enough that if in a society where there are timely early marriages, you just tell them before getting married. But if the childrens are going out and they will get married late, then I think it's better that they should know what is the right sexual activity and how things happen between a men and a woman. So this they should know it even if the marriage is away.
Yeah. Yeah, true. And now with the social media and the exposure, if they don't get the right information, uh, you know,
Exactly.
they'll be going to all these myths and subhanallah.
Yeah.
So yeah, already. So please go ahead and fill in the survey form. It's very, very important to us. We like the feedback. We try to get the speakers on topics which are important to fill the gaps of knowledge. So please go ahead and make sure you're filling those the survey form which is in the chat before the end of the session, inshallah. Yeah, so I think we had a few comments. I think some of them are doing thalassemia tests, but that is a exception. Alhamdulillah, alhamdulillah. And yeah, and I think there's this trend of taking saving the freezing the eggs as well. Yeah, for the future. Any info on that? Any commendation on that? Is that a good practice or
Mm, saving it, yes, you can save it. This is the new tech modality that is halal and can be done. But that those eggs can also be used in a halal relation then. If you are married to someone, only in that case you can use these eggs, but not otherwise.
oh, that's right. Yeah.
Mm.
Yeah. Alhamdulillah. All right. And just a reminder for all the audience here, subhanAllah, as you might have noticed during the presentation, it's so important for the relationship to be built, the communication skills to be developed between the spouses, for having a healthy and satisfying relationship. So please go ahead and sign up to our courses on the findyourtruth.net platform, which are, again, building relationships is a very, very, very useful course. And we have so many testimonies of people who have benefited from that. So please check those out as well. Yeah. So please fill in the survey forms. I think we have only 2 forms filled so far. So please, I would urge you to take a minute and fill it. It should not take long. Yeah, so let me give you a minute. So please go ahead and click the link and fill in the survey. We'll take a minute for that. Please fill in the forms. If any questions, please let us. And Dr. Raheel, I think out in the social media, there's a lot of mention about the way sex toys and lubricants. Any recommendation on that? Would you encourage that or not? Any
The book that I have mentioned, and it says about the toys that it can be used among the spouses if you want to enhance the intimacy. So it's okay.
Yeah.
Mm.
All right. There's, I think, so Dr. Raheel said there are around 700 eggs that a woman has in her lifetime. Okay.
7 to 400, and with each cycle, you don't know how many eggs will be destroyed, right? But there are tests that will tell you that you have eggs still in your ovary, and this can be seen by simple blood test, and you can say that I have time or I don't have time simply by a test.
Yeah. I mean, especially for women who are getting delayed, in their marriages for any reason. So this is something I want to talk to their gynecologist about. So there are options how to freeze eggs for future, future. Okay. All right. Dr. Faida, any questions you had or anything else you wanted to add?
Well, I was just wondering whether people were being shy in asking questions. It's a topic we haven't spoken much about, or we don't tend to talk about. So it's a start, and Dr. Raheel will be joining us for 2 more sessions. So I would say that think about it more and write your questions down. It's good to ask. We are just coming out of this cycle of a taboo topic.
There's another myth that I hear too often in the community here in Denver. Once your kids are grown up and they count grown up as 8 and 10, you don't need to mate. And women believe that. I've heard from several women.
Really?
So address that, please, as well as, 8 and 10 grown up, of course. Where are we, right? Her kids are already, past graduation point. And then second thing is that after 40, women don't have any feelings, and that's normal. I don't think so. So address those two things, and how do we treat them about, and how do we explain to them that no, it's not normal to not feel anything in downstairs past 40, and they need to fix it for themselves and for their spouses, right?
Um, well, this is a myth, definitely. The reality is that the ovaries are still producing the hormones, and these hormones are keeping that area down there very much alive. And so whenever it is aroused, it is going to respond, right? The simple medical fact is like that. But yes, there could be delay. It could be slow. It could be needing more time. These are the possibilities, but because the anatomy and physiology says that it is there, so it is there. It's a myth that there nothing is down there. And you can even teach the sometimes I have to teach my female patients that if you yourself don't feel that see the complaint, they say that their husbands don't feel the pleasure now. So then I tell them, first you do you feel the pleasure? They say yes. Do you want to give him the pleasure? Then you can do this voluntarily, that you contract your muscles, and once they start doing it, they usually overcome this problem, both of them, and then they feel it good. And then it becomes their routine also somehow. Okay, if they don't feel these contractions involuntarily, they can do it voluntarily, just to make each other happy with themselves. And similarly to men, we tell them, see, you need to be more patient, you need to be more kind towards the end of reproductive age, but this pleasure in each other's physical company is always alive if you keep it alive. So that's how I tell them. Uh, about the children, mm, if you have time and space, see, when the children, many people, they have their children along with them in the rooms, and this again, Islam tells us about this privacy of husband and wife. So after age of certain age, a child cannot stay with their parents, and it has been told that they should have separate rooms. So if these things are being really practiced, then this will keep this intimacy bond very alive till end.
Yeah, absolutely. Sister Faida, if you want to just put in the name of the book in the chat, or if you just want to put that slide so people can
Yeah.
know that
Are we
name of
still
the
being recorded?
Yeah.
yeah.
I think once we stop it, some people might come